There is an epidemic of sorts around the world, an epidemic of fake medicine, substandard medicine, medicine that does not deliver what's on the label, marketed by a largely secret network of manufacturers and traders, a network we trace through ports and cities on 3 continents. And while the peddlers of these fake medicines make fortunes, those who could do something about it, governments of prosperous Western nations, the hugely profitable pharmaceutical industry, even the prestigious World Health Organization, all of them have failed to stop this deadly trade.
We're talking about a hidden disaster, a catastrophe in medicine.
Dr. John Dunn recently retired from the World Health Organization in Geneva, Switzerland, where for years he tried to expose the global trade in fake drugs. 1995, World Health Organization report which found the following. Of 26 analyzed samples of an antibiotic, 10 contained too little active ingredient, 4 contained none. Of 49 samples of antibacterial tablets, 6 contained an insufficient dose, 6 others contained no active ingredient. Is this what we're talking about?
Precisely. Any company that wants to infiltrate the market with counterfeit, substandard drugs can, in many countries, do this with absolute impunity.
Well, that's astonishing.
Well, I hope it is astonishing to the people that are watching this program, because that is the reality.
The reality, the bitter reality, is that people are dying in developing countries around the world because of this multi-billion-dollar onslaught of fake drugs. To learn more about it, we visited the impoverished African nation of Ghana, in the heart of the meningitis belt, home to virulent strains of malaria and tuberculosis and other diseases. And all across Ghana, pharmacists told us
it is a fake product,
which did not contain any active ingredient at all.
We gave it to patients. They didn't respond.
And where do these fake drugs come from?
Fake drugs can come from anywhere around the globe.
For instance, India. Michael Addo, another pharmacist in Ghana, recently traveled to India in search of drugs that might be less expensive. He told us he met a manufacturer there who volunteered to make drugs for him at 1/5 the regular cost, but also at only 1/5 the potency listed on the label. What kind of drugs?
Anti-malaria tablets, which normally contains 250 milligrams. He was willing and prepared to produce it with only 50 milligrams.
Mr. Addo angrily rejected the offer, but others have accepted. He says doctors have told him that as many as 10% of all hospital deaths in his country, Ghana, are due to fake or subpotent medicine. A figure we obviously could not confirm, but we were able to confirm that in a tragedy that went largely unreported, some 60,000 patients in the nearby country of Niger received fake meningitis vaccines, and as a result, many hundreds of them either died or suffered permanent brain damage from meningitis. Some of those fake vaccines illegally bore the brand name of the giant global drug company SmithKline Beecham. How does this substandard, subpotent, counterfeit medicine move undetected around the world from manufacturer to pharmacy? With the help we found of a thriving network of brokers and traders. You write about the shadowy world of international brokers and traders.
Well, because it's shadowy to the rest of us. We simply don't know what goes on because there is no control of these people.
That shadowy world had a harsh light cast on it 4 months ago when we reported that an apparently fake ingredient found its way into a medicine that killed 88 children in Haiti. As a result, various Western health officials took a look at how these chemical traders do business, and it turns out many of them do business in some of the world's most prosperous shipping ports. And while the consumers of these second-rate drugs are usually poor, developing countries, the traders go about their business virtually unimpeded by their home governments, governments that would never expose their own citizens to such dangers. Rudolf Boulos, the Haitian pharmacist who unwittingly imported from a broker in Germany the Chinese-manufactured poison that killed those 88 youngsters, says he would not knowingly have bought pharmaceuticals from China, a country known for producing fake drugs.
The German not only sold it to me, but they gave me the guarantee of the German industry with it. It came with what credibility Germany has. And this is where Germany, to me, is responsible.
So, to understand how one major drug broker does business, we looked into the background of Helm, the German company implicated in the Haiti episode. One of Europe's largest brokers, Helm has offices in 37 countries, including the United States. A Norwegian pharmacist, Kirsten Meir, has had dealings with Helm.
I know many incidents where they've delivered substandard drugs and also substandard raw materials.
Kirsten Meir went to Botswana in Africa a decade ago to help that country develop a drug distribution system. After arriving, she began distributing a potent anti-tuberculosis drug called rifampicin, which had been purchased from Helm. And then, to her astonishment, a nurse one day
Wanted to give this drug, which came in a capsule, to a patient who could not swallow capsules. So she tried to empty the capsule to put the substance in a tube. And she discovered that the capsule was empty.
And how many capsules did she buy from Helm?
I think we bought 2 million capsules.
2 million.
Yes.
Meir estimated that 20 to 60,000 of those capsules were empty. So the people who could swallow the capsules
Yes.
were swallowing nothing.
Yes.
And Meir said there were problems with other Helm drugs, including some that were labeled incorrectly. Finally, at her urging, Botswana blacklisted the German company Helm. Meanwhile, other African countries, Ghana and Benin, were having their own problems with Helm. We came here to Hamburg to get Helm's response to allegations that they have regularly been sending substandard, second-rate drugs into developing countries. But Helm officials here simply declined to talk to us about it on camera. But we did talk to Peter Zamori, a medical doctor and a member of parliament in Hamburg, Germany. Last year, some former Helm employees, troubled by Helm's role in the Haiti poisoning, went to Dr. Zamori with a pile of documents suggesting that Helm had lied to customers about where the drugs were made and when they were due to expire. Are you saying that they do it with knowledge of what they are doing?
Yes, because these former workers showed us documents which proved that there were real orders to betray the receiving countries.
So Dr. Zamori called a press conference in Hamburg in which he presented a bill of particulars against Helm. And?
Helm didn't react.
You mean they just don't give a
They are
damn?
totally cynical. They say, it doesn't matter. We go on making our profit this way.
As a politician and as a medical doctor, you must have been horrified.
Absolutely horrified.
A German newspaper, however, has reported that Helm strongly denies any wrongdoing. Fake pharmaceuticals are horrifying not just because of the damage they do to people who take them, they also interfere with efforts to stop the spread of infectious fatal diseases.
What is happening now in developing countries is that there are cases of untreatable tuberculosis, and we can expect more and more of them unless the medicines that are offered to these people work and work really well.
And that, of course, could spread.
Well, it's spread, yes. Where? Back to the United States. Why not? Tuberculosis is a global emergency, and every effort has to be maintained to ensure that the drugs are used effectively, and that means that the drugs themselves must be effective.
We wondered what the world's biggest pharmaceutical companies have done to stop the trade in counterfeit and substandard medicines. And we discovered something they would prefer we didn't know about, that they have set up the Pharmaceutical Security Institute, a secret group put together by the world's 20 biggest pharmaceutical companies to gather intelligence surrounding the sale of fake drugs. You've heard of a group called the Pharmaceutical Security Institute.
I've just heard of it, yes. I know nothing more about it.
Dr. Harvey Bale, who helps to oversee the Pharmaceutical Security Institute, said in a letter to 60 Minutes that drug supplies in this country are safe, but that they have evidence of what he calls a pharmaceutical underworld that preys on patients in developing countries. But he told us that the pharmaceutical industry would not let him talk to us about it on camera. In the past, the industry has said that any public discussion of counterfeiting might damage their image, their logo, and thus their profits.
It's closed information. It's not available to others, as far as I know.
Why?
Well, if it is known that counterfeit substances of Company X are available on the market, people avoid Company X and go to the competitor for their products.
And remarkably, WHO, the United Nations World Health Organization, must share the blame, for they regularly publish a list of cheap pharmaceuticals manufactured around the world without first checking on their quality and safety. Recently, Britain's top medical journal, The Lancet, questioned why the WHO does that. We went to Geneva in Switzerland, headquarters of the World Health Organization, to talk to Fernando Antizana, the group's #2 man. Antizana oversees WHO's controversial drug program, and we asked him how he can be sure that the drug products WHO advertises are not fake.
But how can WHO be sure under any circumstances that a drug is of the proper quality? You don't have testing stations all around the world.
No, we don't do that in any case. What we do is we provide to the member states with the guidelines by which they can do themselves.
But do they have the capacity? Do they have the capability?
Not all the countries.
If you can't assure the quality yourself, how do you expect fledgling companies in developing countries without the resources, without the techniques, without the understanding to involve themselves in this testing? It is surely disingenuous to offer these materials under those circumstances. Not only disingenuous, but dangerous.
Well, it turns out that Dr. Antizana, the man overseeing the WHO campaign against fake drugs, is a bit of a fake himself. For here is how Dr. Antizana, a leading candidate to take over the top job at WHO in an election this month, was introduced recently in Vancouver at a major pharmaceutical conference with words based on a WHO press release.
Dr. Antizana received his doctorate in pharmacology from the San Simon University, Cochabamba. He holds diplomas in public health and international relations from Harvard University, United States of America, and in health technology from Stanford University in California.
Is all of that accurate?
Well, I think so.
Well, no.
Yes?
San Simon University told us they have never awarded a doctorate to Antizana, and there is no degree from Harvard. And as for Stanford...
It is, well, it doesn't say from, well, I don't know what it says exactly there. Is extension, Stanford University extension, Stanford University extension in Lima, Peru.
In Lima, Peru?
Correct.
You know something, Dr. Antizana?
Maybe I'm not a doctor then, according to what you said.
Well, if he's not a doctor...
Well, I call you Dr. Antizana. What am I going to say? Mr. Antizana?
Anything. Sometimes it's better to be Mr.
Mr. or Doctor. It turns out that his WHO, the pharmaceutical industry, and governments around the world have failed to stop brokers from peddling fake medicines, or in the case of Haiti, an outright poison.
Obviously, the Haiti incident is a watershed. It has alerted many people to the real dangers of this situation. People are coming forward. I'm coming forward because I am distraught by the fact that things are out of control. The Haiti incident should give us all impetus to do something about this.
After our interview with Fernando Antizana, the second in command at the World Health Organization, Antizana withdrew his candidacy to run that organization.